Hi, I'm Annie Sleece, and I'm on the staff at NAMI Delaware. This is part of a discussion series focused on back to school community resources. We're talking with state agencies who work to support youth and families in Delaware. But before we begin, I'd like to tell you a little bit of information about NAMI Delaware. NAMI stands for National Alliance on Mental Illness, and we are the Delaware chapter of the national organization NAMI, which is the largest grassroots mental health organization in the country. There are NAMIs in every state and hundreds across the country. So if you're viewing this video right now and you don't live in Delaware, you can find your local NAMI by visiting their website, nami.org. NAMI Delaware offers support, education, and advocacy to those affected by mental illness in Delaware. Now, not only those who are diagnosed, but also those who care for them. You can learn more by visiting our website, and you'll also be able to find some mental health related resources offered in our state. Click the Education tab and select Resources. NAMI Delaware is not a crisis response agency, but before we begin today, I'd like to make sure that you have connection to crisis response should you need it 24/7. You can call Delaware's Hope Line, or you can text the National Crisis Text Line. Text DE to 741-741. Today, we're talking to Tony Avallone from Champions for Children. Welcome, Tony.
Hi, thank you. Thank you for having me.
Absolutely. Thanks for taking a few minutes during this busy back to school time. So we'd love to hear about your work at Champions, but for those, and I want to hear about you personally, but first, let's just touch base a little bit on what Champions for Children is, and then maybe share your role.
Okay, sure. Champions for Children's Mental Health. We provide peer support and guidance for parents and caregivers who have children or raising children with mental health or behavioral health concerns. We're there to navigate them through systems of care, help them with get through the school system, IEP meetings, also help them find different resources in their community to help them as a family, or to help the child, or even to help the parents.
Right. And you got involved when?
I'm going on my 4th year now with Champions. I've got the job, got this passion to help other people. Not because of my degrees or the letters in the alphabet after my name. I got it from lived experience. And that's really the main criteria, is having the lived experience, having a child of your own who's been through what other families are going through right now. And I really enjoy what I do. It really feels rewarding knowing that there's other people benefiting from the experience I've had and the struggles I had, and then helping them get through those same struggles.
Absolutely. Having help navigating that really challenging time is so important. And also the lived experience aspect is so important. NAMI does a lot of our work is involving people who have lived experience, helping other people through something similar. So it sounds like our work is quite aligned.
Yes.
So when you're thinking about the work you're doing at Champions, it's really the family who needs your help and then your team supporting that help. So how does that relationship work? How do they find you, or do you find them, or how does that work?
Well, we do some outreach, but most of our referrals we get through the Division of Prevention and Behavioral Health. We also get referrals through clinicians and therapists who know about us. And there are those rare occasions where we'll actually have a judge in family court or mental health court say, "Hey, there's Champions out there. Seek them out. Get some guidance through them."
Okay. And is there a particular list of criteria that a family has to meet?
You have to have a mental health diagnosis, and you
As
have
a child,
to,
right? The child has. Okay.
Yeah. We see children as an early young age all the way up to their 18th birthday. And we're also working on another program to go beyond that. But once they get that referral, we're able to go out and assess, talk with them, and see how we can help them.
Right.
And they have to have an outpatient therapist going on at the same time.
Oh, okay. All right, good. And then you help them navigate that outpatient treatment plan, essentially, right?
Yes. And there's
how long do you typically help a family? Like, how long would a family work with one particular team member of Champions?
Old school, it used to be from 6 to 9 months, but we generally stay with the family as long as they need us. If they need help advocating, our main goal is to help the families advocate for themselves. That we're trying to teach them the skills so they can do this on their own. Some families pick it up right away. Some are already doing it, but we're just there to guide them just a little bit more, give them a little nudge during those IEP meetings. Others really need our help because they're going through different challenges. Not every situation is the same. So there are families that we have and we're out within nine months, but we're still following up and checking up with them. And there's other families that I have personally on my docket now for at least 2 years.
Wow. Okay.
We give them some room so they can grow and show that they can do the advocacy skills. And then there's times where, Tony, I need your help, and I'm back in the picture to help them out.
That's great. That's great. So I would suspect that this time of year, you might see a difference in needs. I mean, what does it look like from back to school time with
during the summertime? It does slow down just a little bit. We still see the families on a regular basis, but it may not be as intense. Families are on vacation. There are some families who just let their children do what they want during the summertime. We get occasional calls where the children just get bored and they just need that extra, mom needs that extra support. But then when school starts, it's back to grind again. We're working with the parents. We're working with the schools to make sure the IEPs are in place, reviewing those IEPs to see if there's anything additional that needs to be added. Especially now with COVID and everybody returning back to school who's been virtual before. There's things that have been missed over the years. So now it's time to get back to the drawing board and find out what it is that we can do to help the child get back and have a more successful time in school.
Sure. So I would suspect that this is probably a really busy time. Now, so it's hard to imagine, but this is actually the third school year that COVID has impacted us. So isn't that hard to imagine? But it's true. So this will be the third year, 18 months of COVID. Has COVID really changed the way Champions is operating?
Yes. Before COVID, we were strictly face-to-face. We didn't we talked on the phone every now and then. Mom or dad or the aunt would text us, grandma or grandpa would be texting us to say, hey, this is the situation. We would text back, maybe follow up a phone call, but we mostly focused face-to-face. During COVID, we were forced to go the telehealth route. We weren't too happy about it. And we had a mixture of families who liked it, other families who did not. I personally like that in-person feeling. I like to engage, eye-to-eye contact. We're trying to phase that out now. There are a few families that still want to do that Zoom meeting, but there's other families who welcome us back into their home. We do see them in the home, in the community. There's never seen them at an office or anything like that. That's their doctor's office or someplace like that. But we're always trying to see them in the community or at their home. And for the most part, they're very welcoming. And during COVID, it was very hard. And sometimes it's hard not to get involved. And there's, you hear stories and you just want to reach out. And it's hard to do that when you're in Zoom and you're in person. It's a lot easier to help share that experience.
That's true. That's true. And we've all just had to develop our own skill set when it comes to operating Zoom, hasn't it? We all know how to do it now, which is pretty wild. So you mentioned something earlier, and I want to circle back on it. You mentioned transition, the age of transition, and I think you have a new program or something you're working on with regard to that. Do you want to speak to that?
We're starting a new program right now for children once they turn 16 to start working with the families to get them ready for what services they will need once they turn 18. There are right now they're involved with prevention of behavioral health. PBH is what we call them. Back in my day, it was child mental health. So I'm dating myself now. But we don't want to see anybody being lost in the cracks or getting that loss of services because they didn't know what to do once they turn 18. Sure. Parents and the caregivers are really flustered, not knowing what's the next step or what agencies really play a role. So we're going to start working with, and we are starting working with the children when they turn 16, informing the mom and dad what is out there, what's involved. And then as they turn 17, now we're pulling in the different adult services into play, talking with them to show so they can demonstrate to the parents what is involved, what is actually out there that they can get their hands on for services. Examples of different agencies is DSAM, Division of Substance Abuse and Mental Health. They have a program for mental health and substance abuse. They also have different types of clinics, the Bridge Clinic. If you need mental health services, you can go there once you're 18. On the other spectrum, we have Division of Developmental and Disability Services, DDDS. There are services for adults once they turn 18 there. They do have some things for children, but it's not as active as once they turn 18. So we're trying to bring them together. There's also Vic Rehab. There's also employment programs out there to help teach skills and get the children the techniques they need to actually get a job and maintain a job.
Sure.
So we're there to help hold that bridge together to make sure they can access these services.
You're right. And it is a bridge. That's
yeah,
exactly what it is.
Eventually, we would like to be there just past their 18th birthday, just so we can engage with them. Just to share a personal story, if I may, I have a child, once turned 18, want to stop medications altogether. And what do we say? So we're hoping to engage more youth peer supports to help them talk directly to the children, to demonstrate the importance it is to keep treatment going, to keep maintaining it. Even though you're 18 now, you're the adult and you can make your own decisions. It's good to hear from somebody else, hey, I've been through it. Why don't you stick on it just a little bit longer? And that also helps, I guess, that same word again, bridge that understanding of what is out there, what can help me be more successful once I become an adult.
Sure. I think there's a lot to be said for that age range. And if families can be kind of informed early and really start having that conversation like you said, at the age of 16, 2 years in advance, by the time they turn 18, hopefully they've got some good ideas of the benefits to maintaining their mental health through their treatment programs. That's terrific. So
I think
I'm sorry, go ahead.
I was going to say, we also engage the schools during the whole process too, so they can actually give their point of view and their suggestions too. They're after high school. Maybe there's some programs out there, educational programs, such that the child may be qualified for to advance their education out after they turn or after they graduate high school. So we do engage even the school system during that transition time.
Oh, that's great. That's really good to know. So if viewers right now who are looking at this video would like to reach out to you, what's the best way to get connected to Champions for Children?
Well, we have a website. It's championsdefordelaware.org. We're also on Facebook. If you just go in and just search for Champions for Children's Mental Health, we'll pop up. We also have a email address they can use. I think it's on the screen, info@championsde.org. And again, talk to your child's therapist about Champions. We go by the title family support provider, but we're peer support. So you can ask your therapist, your child's therapist, for peer support. Again, we do our services directly with mom, dad, and caregiver. That's who we serve directly. The child can be there if they want to be there. They don't have to be. I do try to interact with mom and dad and the grandparents, the caregiver, with the child, but they don't have to be there. Our goal is to get mom and dad the tools they need to be able to access the resources they need. So again, ask your therapist for our services, or if you're involved with PBH, you can ask them about our services as well.
Great. So one more question. I've been asking the same question of everyone that we're hosting for this discussion, because I think this is such an important element to this time of year. The back to school time, we get so busy, we get so flustered with all the things going on. I just wanted you to take a moment and share with our viewers any tips or advice or message for them with regard to back to school this year.
Be patient. Be patient with your child. Be patient with the school. The system will work if you let it to work. You have to really put the child first. And also, a second thought here is to maintain self-care. We really do instill that on our families, that mom, dad, the caregiver, you got to take care of yourself, because your child does need you. And without you being in good health and in the right state of mind, you're just at the same place as you were, as where your child is. So definitely take care of yourself and be patient with everything.
Absolutely. I love it. Thank you so much, Tony. We hope you'll come back and have a chat with us again. Have a great beginning of the school year.
Thank you. I appreciate it.
Right. Bye-bye.